We go now to Laura Windsor with a report on cancer survivorship.
Getting through cancer treatments can be tough enough, but what about once the treatments are over? Cancer survivors have to cope with changes in their life in different ways. We spoke with Dr. Michael Krychman, a board-certified OBGYN, author, a world-renowned sexual health specialist, and an expert in survivorship medicine.
Cancer survivorship really encompasses several facets of medical care. It not only includes prevention of recurrence and prevention of cancer, but also promotes general health and wellness. So very often, men and women who experience cancer and its treatments to keep disease at bay suffer from consequences of their treatment, whether it's surgery, radiation, or chemotherapy. We really look at a combination of two facets. One is sexual medicine, and sexual medicine really encompasses a change of hormones, of neurotransmitters, veins, arteries, nerves, and how it really affects the sexual response cycle. In addition to the physiological or medical issues, there's also psychological things as well. Women are dealing with stress, they're dealing with the fear of recurrence. Partners as well may have changed as well because there's some concern over roles and how people will react to cancer. So really we see a very big interplay between both the physiological medical issues as well as the psychological issues that certainly have effects on the person and the person's partner as well. Two of my most popular books that I've written are 100 Questions and Answers for the Woman Living with Cancer, a practical guide to female cancer survivorship, as well as the book entitled 100 Questions and Answers about breast cancer, sexuality, sensuality, and intimacy. It addresses the issues and concerns that many women suffer from in terms of how cancer and cancer therapy have impacted their relationships and their relationships with their partners as well. Very often it's a process to address the symptoms and really help them feel whole again. There certainly are exercises that women can do to regain their, what I would call their sexual self-image, how they view themselves as sexual beings. And in the cancer world, we really talk about the new normal. We understand that things may change and things may be different than they once were, but it doesn't necessarily mean that their sex life is over, and it doesn't mean that they can't really have a positive view on sexual function as well. Very often, women and men alike are really undereducated about the ramifications that may happen as a result of whether it's chemotherapy or radiation, or even loss of hormones because they go into acute menopause. One of the biggest concerns is vaginal dryness, and vaginal dryness leads to pain, and it can also result in lowered sexual interest. One of the concerns that I find quite important is that many women are really suffering in silence. Women who may be on birth control pills, women who are breastfeeding, or even women who go through the menopausal transition. All these may have lowered estrogen stores. And moisturizers, which are safe, non-hormonal alternatives, they are put into the vagina 1 to 2 times a week, really have been shown to be effective in reversing this atrophic or vaginal changes. Replens is one of moisturizer that has been clinically proven in research to really reverse and restore the vaginal lining. Remember that it's not only for women who have gone through the menopause. Very often other women are also suffering from dryness and may benefit from the use of a vaginal moisturizer like Replens as well.
It's important to tell your doctor about any changes in your sex life to make sure there isn't an underlying medical problem. For the American Health Journal, I'm Laura Windsor.